If you are someone who wake up with sour taste in your mouth, feeling burning sensation in your chest after eating, or constantly clearing your throat, and you have been living on antacid thinking it's just too much acid in your stomach, well, this episode might change how you understand your body. Because acid reflux is not always caused by excess acid, and suppressing them can even make the problem worse. Welcome to MedHerb Talk, a place where ancient science and modern medicine meet to give you a clarity about your health.
From the soil to the soul, healing has always had a voice. This is MedHerb Talk, where nature speaks, and we listen.
Today, we are going to break down GERD and acid reflux properly. And we are going to learn what it stands for, where they happen in the body, why they happen, what to eliminate from our diet immediately, herbs that actually soothe the damage, and when medical treatment is necessary. Now, let's quickly look at what is GERD. G-E-R-D. Acid reflux happens when stomach contents move backward into the esophagus. And when this becomes chronic, it is called GERD, gastroesophageal reflux disease. Between your stomach and esophagus is a muscular valve called the lower esophageal sphincter. The job of this valve is very simple. It opens to let food enter your stomach, and then it closes to keep food and stomach acid down within your stomach. When this valve weakens and or relaxes inappropriately, acid from your stomach travels upward to your esophagus. And your esophagus does not have the thick lining your stomach has, so it burns. GERD and acid reflux happens in both babies and adults. In babies, symptoms include discomfort after eating, spitting repeatedly, having discomfort refusing food, or having sleep issues. In adults, symptoms include burning chest pain that looks like heart attack, burping consistently, bloating, having a sour taste, chronic cough, difficulty swallowing, and asthma-like symptoms. I know some of you are asking why this matters. This is important because chronic irritation like this can lead to complications like Barrett's esophagus, which then also contributes to cancer. So this isn't just some kind of discomfort you feel. It is an inflammation that has been built up over time. Now, what do we need to eliminate from our diet first in order to prevent this? Just know that you cannot out-supplement a bad diet. Things like fried food, excess oil, spicy food, chocolate, peppermint, alcohol, caffeine, carbonated drinks, tomato sauces, or excess saturated fruit actually trigger these symptoms in you. And you'll be surprised to know that one of the biggest triggers is overeating. For some of us that like to eat overplus, this is one of the biggest triggers ever. Consuming large portions of meals increases stomach pressure and pushes the acid upward. Another critical thing is lying down right after eating, especially maybe 2 hours after eating, is also a contributing factor to acid reflux and GERD. Here are a few things we can do to change our lifestyle by preventing GERD or limiting acid reflux. Number one on the list is eat smaller meals. And then we have staying upright after eating. Do not just rush and lie down immediately after eating. And 3 on the list is elevating the head of your bed slightly so that when you lie down, the food content wouldn't come up in your throat. 4 is always lying down on your left side after eating. Also remember to maintain a healthy weight and going for a walk. Know that going for high intensity workout immediately after eating can increase acid reflux. And stress, it increases acid production and weakens LDS. Now, how do we treat acid reflux and GERD? When it comes to herbal Asian medicine, in ancient times, there are few herbs that have been used to coat irritated tissues and reduce inflammations. Some of these herbs are slipper and marshmallow liqueurs, specifically DGL, aloe vera, and chamomile. These herbs form a soothing mucilage layers that protects the tissue of the stomach while healing occurs. Always remember that herbs support healing, but they must be paired with diet correction and a healthy lifestyle. Another important thing to look at is the use of long-term acid suppression drugs can reduce the absorption of magnesium, iron, vitamin B12, and calcium. All of these things matters the most, but self-diagnosing low acid reflux is very risky and can lead to damage or cancer in the future. This is why going to a medical facility and getting tested and diagnosed is the best appropriate things to do. Now, when it comes to medical approaches, treatments like anti-acid, H2 blockers, proton pump inhibitors are things that are helpful for severe inflammation, ulcer, and short-term healing. But long-term, unsupervised use of these medications can impact gut balance and nutrient absorption. And remember that GERD is not just too much acid. It is pressure, diet, inflammation, stress, and mechanical dysfunction. Your body is not attacking you. It is responding to a pattern. So if this episode gives you clarity, share it with someone that needs clarity as well. This is MedHerb Talk, a place where we combine evidence-based medicine with herbal wisdom. And remember, we are not here to diagnose or provide prescription. This podcast is only meant for educational purposes. And if you are passionate about understanding your body deeply, follow this channel for more conversations like this. Until next Friday, I remain your host, Marklin W. Wingba. See ya.
Talk, we dey listen, no. Let her talk, let it flow, rooted in the earth.